Welcome to today's webinar about operationalizing your remote patient monitoring launch, presented to you by ClearArch Health. A little bit about ClearArch Health. We are the healthcare division of Mobile Health. Mobile Health is an enterprise industry leader in personal emergency response. On average, we ship about 4,500 kits of devices directly to end users, meaning patients, members, and in some cases, retail customers. So we are able to manage logistics and technical support in such a way that we take on the front end heavy lifting for your programs, and then you're able to focus on the clinical oversight of remote patient monitoring. We thank you for joining us today. You can advance this slide. Thank you. So I'd like to welcome you to today's webinar, and I'd also like to welcome the participants who will be speaking in today's webinar. First up, we have Chris Otto, the Senior Vice President of ClearArch Health. We also have Tiffany Horn, who is a registered nurse and our Clinical Services Manager. And our special guest is Dr. Subramanian. He's with CarePortMD. And Dr. Subramanian is a board certified emergency medicine physician with 20 plus years of background in both acute care medicine and the development and commercialization of technology solutions for health and pharma. He is currently the CEO and co-founder of CarePortMD, a technology-based coordination services that leverages telemedicine and live care navigators to improve patient access to low-cost integrative care. And with that, welcome, Dr. Subramanian. I am so pleased that you're able to join us today. Do you mind starting with a little introduction about you and CarePortMD?
Thank you for that introduction, Doreen. CarePortMD was built on the idea that healthcare is riddled with inefficiencies. As an emergency physician over the past 20 plus years, there's no better vantage point to witness those inefficiencies. When people show up in the emergency department is because they have been systematically failed. Their disease has been uncontrolled, or some safety issue has caused an accident, and we're always playing cleanup. So it's more of a reactive medicine that's very expensive and inefficient, and it's uncoordinated. In other words, not aligned with what might be the well thought out care plan of the patient's primary care provider. And so that isolated care, reactive care, is very inefficient, and people and the system pay the price. And so the later part of my career, I really felt it important to focus more on becoming proactive in terms of healthcare as opposed to reactive, and recognize that there was a role, given the emergence of telemedicine technologies and computer technologies and the ubiquitous access to wireless technologies, for mobile health to be a part of that solution, particularly focusing on improving convenient access and improving the availability of actionable patient engagement. And so the company we started, CarePortMD, is more of a healthcare catalyst than it is a healthcare provider. While we can fill in the gaps when necessary, we recognized a need to be able to create the environment for patients to access care and align the delivery of healthcare, the infrastructure of healthcare, with consumer demand for convenient, affordable healthcare. So that's a concept of CarePortMD. Now, in terms of actionable engagement, there's a lot of white space in between medical encounters where the action happens, and vital signs are a very important part of that. And so anytime that you can fill in the dots and create a better resolution picture of a clinical situation, it gives you a better opportunity to respond earlier upstream and be proactive as opposed to reactive. And so RPM, remote patient monitoring, is a big part of driving the downstream clinical interventions that we then catalyze for our partners.
Well, and you really envisioned adding RPM in early on in your business plan. It seemed like it was a vital part of your model. And even before the pandemic, this was important to you. So can you kind of step back and speak to the audience about that? Because a lot of these members of the audience have experienced post-COVID delivering telemedicine at scale. And one of the things we've uncovered is that there's gaps. They're missing patient-generated health data. And for you, that's been an integral part of the model of care. Can you speak to that a little bit?
Yeah, part of the actionability of good healthcare relies on context. And there's only so much context you can get through a phone call, for example, or even just a video encounter, which is where most of telemedicine is. It's a doctor talking to a patient and then getting a history and maybe coming up with some recommendations. But really, the diagnostic ability of the clinician is expanded exponentially if you have even just one set of vital signs, as you may get in one of our retail clinics for a telemedicine encounter. But imagine if you have a range of vital signs that spans from the previous clinical interaction to the current clinical interaction, through which you can observe trends and correlations that can help you better understand all the variables that relate to that patient's current state at the time you're evaluating them. And maybe it's a compliance issue that you identify. Maybe it's an adherence issue identify. Maybe it's an adverse reaction to medicine you identify. Maybe it's a psychosocial event or condition that you identify. But that context enables more responsible clinical decision making in a more efficient, rapid manner that is telemedicine. So it's a much richer clinical engagement over a shorter period of time, which then translates into greater efficiency across the spectrum of care.
That's great. Can you focus in on the patient for a minute? What does patient engagement look like in your model of care? Because you have patients who you directly monitor, and then you also monitor on behalf of other clinical teams. So kind of speak to, your interaction with those patients and tell us how your patients feel about participating in a remote patient monitoring program.
Yeah, it's a great question, because adherence and compliance are the bane of our existence as clinicians. How do you get patients? It's the whole lead the horse to the water allegory, but you can't get them to drink, and everybody knows all the variables, some seemingly insurmountable, that lead to that situation. It almost becomes helpless in some ways. But what you do recognize is that if people have some control or some ability to be involved, then they become self-starters and they become more engaged, and you start to see those key performance metrics that you look at really start to improve on a sharp curve. And one of the things that's great about RPM is that the devices are familiar to everybody. People know what a blood pressure cuff is. They know what a pulse oximeter is. Diabetics are familiar with the process of checking their blood sugars. So the devices are really nothing new to them. What is new, and is basically a transparent thing to them, is that they connect invisibly through Bluetooth, wireless technologies, to a system where that information can then become actionable through monitoring and then subsequent clinical interventions. But the process to them is the same, other than the fact that they have to get in the habit or be interested in taking the few minutes a day that's required to do it. And that's a challenge. And we learned that's a challenge. And one of the anecdotes that we've learned over the past 6 months of doing this is that you can give a patient free medicine, you can give the patient free care, you can give them free technology, but that's not going to make them use any of it. They may not value it. What they do respond to, however, is the sense that the person asking them to do these things is really interested in their health and is listening to them. And as we get involved in some interactions with patients in some of our client practices, we recognize that some people are more interested in talking about their cats and their grandchildren who live far away and they're not able to see them, or their bowel habits, or the fact that their doctor doesn't seem to listen to them and they just want to talk. And the more time you give those patients, the personal interaction you give those patients, the better their compliance is. And the better their outcomes are, at least in terms of normalization of blood pressure and normalization of A1Cs, normalization of those chronic, those metrics that we use to evaluate risk in chronic disease. They actually improve because the behavior is improved. And so there's a need to not just throw technology and the ability to give data, patient-generated health data, but also to make them feel as if this is a system that my provider is really invested in, and this really allows them to care for me the way they want to care for me, and that makes a huge difference. So that's a key part of a successful RPM engagement, to make sure that the data is going to keep coming.
Well, it definitely sounds as though, it's more holistic care. So when you talk about using RPM as an enhancement to the model of care, it does give you that opportunity to step in a timely manner, respond or react to data, even if the patient's stable, right? How about with your clinical team? How does it help empower your clinical team or provide you with better engagement as a physician?
So there are, relationships are built on communications, right? And with a patient, it's a long-term relationship, and the more you interact with that patient, the more valuable and meaningful that relationship is. So even if that relationship comes through bi-directional communications between that patient and staff, your nurse, your social workers, volunteers, and those information from those events are logged, it creates a description of a relationship that's more meaningful than what it might be with an appointment every 3-6 months. And so somehow that relationship is a bi-directional one, where the clinician feels more engaged, patient feels more engaged, and that richer connection is what kind of drives, we hope, improved outcomes.
Very good, thank you.
Mhm.
So, let's think back to your launch and some of the processes that you went through. Um, there's a time during the process of preparing your team for launch that we train your team. You train your team on access to the clinical dashboard, utilization of the clinical dashboard, and really getting a sense about how it fits into your clinical workflow. Can you speak to that process a little bit, and how maybe it set you up in terms of maybe gaining confidence in
Oh,
delivering RP in a different way?
no doubt. So we, at the end of the day, our interest is improving the efficiency of healthcare, catalyzing healthcare. We are not a hardware company, and we're not a software company. We use hardware and software to accomplish our end, and it's a uh, really great help to have a company that handles all that other logistical detail, when we can then focus on the efficiency of the care interaction. So there's no question that working with ClearArch, who handles inventory, who handles training, who handles onboarding, who brings the equipment to the table and helps deliver the equipment, and then is available to provide that technical support on a moment's notice, that allows us to focus on care efficiency, that we could not have done as a small company uh, um, at all, the way that we've been able to do it. And I would also hazard a guess that even the largest of health systems uh, really shouldn't focus on that aspect of things, because they have enough heavy lifting to do in the IT space with the other requirements and constraints that have been introduced into healthcare recently. And so, yeah, it couldn't have been done without a partner like ClearArch.
Thank you. I appreciate that because, working with you too has helped us collaborate with you on development. And so it makes us both stronger. There's directions that we may not have thought of before that because of this relationship, we're able to change direction. And that's really helpful. So a sign of a good partner. Thank you.
Absolutely.
So, we're going to talk in the next few slides about that implementation and launch and what things people expect. One last thing before we go there, Dr. Subramanian, do you have any anecdotes from your programs, any patient stories where something was surprising and you noticed a change in behavior because of RPM being included in their plan of care?
Yeah, no doubt. And I alluded to it just a little bit ago. So there's a particular patient that a client practice had identified as a problem patient, one who had complaints all the time and was always unhappy. And in fact, the first experience with her was one where she was riddling complaints. My doctors have never listened to me. I have all these problems. No one cares. And then she would talk about her cat for a while and then talk about her diet and loneliness and anxieties. And that went on in that first week for about 3 hours of time with our medical assistant. And eventually she just started to talk and talk. And we noticed that the patient started to take her medicines and her blood pressure was getting better. And she actually wrote a letter to the CEO of that health organization saying, you know what, for the first time in my life, I feel like people care about me. And it showed because now we're monitoring her adherence and she's taking her medications, her blood pressure is normalizing, and her satisfaction levels are high. And that was surprising that the thing that made the difference was not the technology, not the service, but it was the human interaction that we were able to provide at low cost, mind you, for that patient. When I say low cost, it was done with a few MAs that basically friended these patients, which led into a program that we've piloted now with the University of Delaware and some other mid-Atlantic universities, where we're recognizing that their nursing students and allied health students could really benefit from interacting with patients behind closed doors in this way to become that friend. And in the process of talking to someone, say twice a week, now, have you taken your medicine yet tonight? Well, why not? Why don't you take time to take your medicine right now? And just kind of being there to listen to stories about dogs and cats and grandkids, and also be a conduit for information between the patient and the care team. But then also participate on the back end during the clinical encounters to see what it's like to deliver personalized health care on an individual level. And then more broadly from a population health perspective in terms of the diseases that we're managing. And that kind of experience for the next generation of healthcare providers is invaluable. And so we're starting to get a lot of momentum behind that and excitement. And it's a way to cost effectively get patients to really embrace RPM, therefore generating better data for you to manage them better. And it just kind of fuels the whole thing. So that's something that kind of spun out of all this that we did not expect when we started. And the other thing that we didn't expect, we were always hesitant to call patients to say, hey, have you checked your blood pressure? Or why haven't you done this? Because me, for example, if I get called at 5 o'clock when I'm just sitting down to dinner with my family by someone that's trying to sell me an extended car warranty, I get irate. I don't want to be intruded upon this way. But these people don't respond that way. In fact, they take it the complete opposite way. Wow, they're calling me. They're interested in me. This call is about me. They're not selling me car insurance, car warranties. This is a positive thing. And so we find almost uniformly that that's a well-received intrusion from us. And so if you're able to provide those touch points, then that just makes it better. And of course, there are those that don't want to be bothered, and you recognize that early, and you individualize their care plan and their touch point map during the program based upon what their preferences are. So
That's
yeah.
thank you.
So
We're going to move on. We're going to go and talk about some of the stages that are involved in setting up a program. And I think the audience will be sending over some questions. I did forget at the beginning of the webinar to inform everybody that today's webinar will be recorded. That includes the recording of all the questions that we receive, and we will be sending out the webinar results after we finish our presentation today. And there will be Q&A at the end, so you can put some questions into the Q&A area. Dr. Subramanian will be helping us throughout the webinar, so he can provide some additional insight about planning and launching a remote patient monitoring program. For now, what we're going to do is talk a little bit about the process. So really what the goal of this webinar is to teach you how to simplify this process so that you can quickly launch a program, start monitoring your patients, and really see the results similar to what Dr. Subramanian has seen. Later in the webinar, Chris Otto will be talking about return on investment, and he'll also talk about some of the CMS changes to the CPT codes for reimbursement. So those things are coming in the webinar. Just hold tight and they'll be on the way. Right now, we'll talk about the timeline to launch. This really is all about the organization, the client partner that we work with. We go through a couple different phases, and so four specifically. And in the first phase, it's really a getting to know you phase. It's really learning about our client partners' vision for remote patient monitoring, learning about what their goals are, the outcomes that they intend to track, and defining what kind of devices they'll need for the populations they intend to monitor. So we do an exploratory phase where we also inform our client partners of the type of technology that we use, the software, the hardware, the kit options, explore whether or not there's a need for additional devices. We touch on whether or not an integration is important. So all of these things are done in the first couple of phases. And in our discovery and planning phase, we actually do a deep dive into the responsibilities of both organizations. Remember, this is a collaboration. This is about meeting the needs of this program using the resources that we have from two different organizations. So ClearArch Health clearly supports with a lot of the technology, the software, the hardware, the services, and we rely on our client partner to focus on that clinical delivery of remote patient monitoring, and our program plan defines that. So it really is the first tool to prepare an organization for implementation, launch, and post-launch adoption. And so to speak about implementation and launch, I'll turn it over to Tiffany Horn, who is our registered nurse, clinical services manager, and she has a great deal of experience in this space and in helping organizations like yours to plan your program. So Tiffany. Oh, Tiffany, I believe you're on mute.
Thank you so much. So I'm happy to be here. Good afternoon, everyone. So after discovery and planning, we go into implementation. And this is an integral component of the program because it's where all the discovery and all of the planning come together. Ensuring that the team is properly trained is essential to launching a successful program. Training should be done as soon as possible and should include reviewing the patient templates that are used to streamline patient enrollment. Once training has been completed and all the database and program rules are in motion, you're ready for your program launch. This phase starts with the first patient enrollment and is in full swing when patients are being clinically triaged to ensure they are meeting the requirements of the program. It's equally important to perform periodic checkpoints until your patient enrollment is up to about 100 patients. By doing most of the heavy lifting in the beginning, you can build and sustain a successful RPM program. So as Jareen mentioned, I am Tiffany Horn. I am the Clinical Services Manager here at ClearArch Health. And Dr. Subramanian talked a lot about the clinical guidance. And so I would like to spend the next few minutes sharing some of the importance of clinical guidance in a way that will help you assist your RPM launch. RPM programs offer an innovative solution to reduce hospitalizations and overall healthcare costs. However, the role that clinicians play is essential in generating revenue as well as helping to make sure that you have better patient outcomes. So there are quite a few areas to speak on about clinical guidance, but I like to use the moments that we have today to focus on 4 key areas. The first is clinical onboarding, which has to do with for both staff and patients. For staff members, it's really important to ensure that the staff understand the clinical value of RPM and that the onboarding is a great opportunity to develop strategies to manage high-risk patients, as well as be able to discuss common clinical pitfalls, such as non-compliance when it comes to patients taking their vital signs. It's equally important to ensure that the staff know how to use the devices so that they can properly educate patients on the device as well as best practices. As for the patients and their onboarding, it's really important to have a clinical welcome call. This way you can ensure that the patients understand the value of RPM, but they also understand how they can improve the quality of their life with the program. This also provides patients with an opportunity to review how to use the device correctly, and you're also help the patients take ownership of their healthcare program itself. So the second bullet is focusing on patient engagement, and Dr. Subramanian talked a lot about patient engagement, which I think is really important. The clinical team should strive to enhance the patient's ability to fully participate in their own healthcare. And this is done by equipping the patient with extensive knowledge and support, which is repeatedly linked to improving patient outcomes. This is an opportunity for the clinician to provide specific clinical guidance to address non-compliant as well as unhealthy behaviors and help the patient maintain a healthy relationship with all of their providers. The third bullet talks about the importance of providing clinical support. So RPM programs give patients the opportunity to stay engaged with their healthcare providers, which I think really provides an opportunity for the patients to receive quality and consistent healthcare guidance from the program. By empowering and supporting your patients in disease self-management, clinicians can help patients gain a better understanding of their disease, their prognosis, as well as their treatment plan. The last but critically important bullet that I want to cover today is patient education. Patients will receive educational materials throughout their program. However, the engagement from a clinician can offer specific patient education, especially after the clinician has had an opportunity to review the clinical data as well as engage with the patient. It's important to continuously review the education materials because healthcare evolves and we know that new guidance is often released. The goal is for the patient to take ownership and maintain and improve the quality of their health through RPM. Education should be consistent. I do believe it should be specific to the patient, and it should invoke a deeper discussion about the patient's health. So now that we've spent a few moments on clinical guidance and we understand how the clinical guidance can help yield better patient outcomes, I think it's equally important to ensure that your RPM program is profitable with CMS reimbursement. So I'd now like to take this time to introduce Chris Otto, our Senior Vice President of ClearArch Health, and he is going to discuss CMS reimbursement. Chris?
Thank you, Tiffany. At ClearArch Health, we are often asked questions about the reimbursement, how that works, how to build programs around these so that it's funded by CMS. So I'd like to take just a minute to review the most common codes that our clients are using today to fund the remote patient monitoring programs and to receive that reimbursement. Most of the codes that you see here have been available since 2019. There's been some updates to that, and I'll cover those. What we're talking about here, these codes are available through standard Medicare Part B, as well as Medicare Advantage. The exact physician fee schedule will vary by physician locale and also possibly by the payer in the case of Medicare Advantage. So just keep that in mind. These are estimated amounts. The first code is CPT 99453. This covers the initial patient education, training the patient to use the remote patient monitoring equipment and get them up and started. That code can be billed one time per episode. And it's worth noting that in order to bill 99453, you must also meet the requirements for 99454 in the billing period to which it's submitted. And 99454 covers the technology component. So the daily recordings of those vitals that are captured in the patient's home, the programmed alerts are covered by 99454. That code can be billed once every 30 days. And as I mentioned, for 99453, you have to meet the minimum 16 days per 30-day period. So the equipment has to be utilized at least 16 days or over half of the 30-day period for which it's billed. So that's really important when you start programs. So some care and consideration in terms of the time on program when submitting the first claim for 99454. And it's also important from a compliance perspective. As you heard Dr. Subramanian mention, it's encouraging the patient compliance and ensuring that they bought into the program is really essential for success. So that's required for 99454. The next code is CPT 99457, which covers the clinical oversight time. It requires 20 minutes of time spent by the billing practitioner or clinical staff or other qualified healthcare professionals. That can, since 2020, that can also be administered under general supervision. So it can, the time spent meeting that 20 minutes can be fulfilled by clinical staff outside of the practice, provided it's under general supervision. So this covers 20 minutes of time of interactive communication with the patient, as well as time spent reviewing their clinical data in the dashboard. And CPT 99458 is new for 2020. CMS expanded reimbursement to allow for additional 20-minute increments up to twice per calendar month, the ability to bill in 20-minute increments for that clinical time. So for example, if in a given month, a patient required 40 minutes of time, managing that patient in the clinical dashboard and interactive communication with that patient, then you could submit a claim for 99457 and 99458 in the same calendar month, up to twice per calendar month for 99458. The last code is CPT 99091. I hesitated to include this, but I'd be remiss not to cover 99091. This was the first code that was available in 2018, the first vehicle to actually fund remote patient monitoring. Actually, the code itself has been around for many years, but it was first unbundled in 2018, allowing providers for the first time to be reimbursed for remote patient monitoring. And this covers the collection and interpretation of that physiological data, the transmission, and the time spent reviewing that data up to 30 minutes per calendar month. The reason I cover it is because in the proposed 2021 rule, CMS did propose a workflow which was a little confusing, which later did not make the final ruling. So it was a little confusing, but there is a workflow that CMS has proposed that would include billing for 99091 on the start of care and then 99457 in subsequent months. We don't actually see a compelling use case to do that. And most of our clients today are only billing for 99454, 99457, 99458. So I mentioned it here just in the spirit of completeness, but most of our clients are not using this today. So I do want to talk a little bit about the 2021 rule and some of the clarifications and expansion of reimbursement. Expansions of remote patient monitoring for 2021. The first one is that CMS has expanded remote patient monitoring to now be used in addition to chronic conditions for patients with acute conditions. In this case, It is expected that there would be a care plan, defined outcomes and objectives, and then once those are met, the patient would be discharged and disenrolled from the remote patient monitoring program. So in addition to chronic care conditions, that can be used for 2021. The second is that CMS has clarified that physicians and the billing practitioners billing for remote patient monitoring must have a prior relationship with that patient before enrolling them in RPM services. So at a minimum, a new patient E&M service must be billed, and presumably during that visit, the physician would have collected enough information to determine that it is medically necessary to enroll patients in remote patient monitoring services. So that will be persistent for 2021. There was an exception made to this for the public health emergency, but despite public commentary and requests, CMS has said that prior relationship must exist for 2021. The third is monitoring of at least 16 days in each 30-day period. So I mentioned this on the previous slide. So I just want to emphasize that for 99453 and 99454. Again, there was an exception during the public health emergency. CMS did allow relax the requirements to bill for 2 days in a 30-day period, but that exception was only for patients that either had a positive diagnosis of COVID-19 or suspected diagnosis. So it's really not a general exception. And CMS, again, despite public commentary, has indicated that the 16-day rule would be observed on a go forward. The next change, which is a little bit nice for programs, is that 99453 and 99454 can be furnished by auxiliary personnel under general supervision. So this works really well with our model at ClearArch Health. We do a lot of the technology support roles, and it's acknowledged by CMS that can be administered by auxiliary personnel and does not have to be strictly clinical staff administering the technology. Number 5 is that the data must be electronically collected. So beginning in 2021, manually entered vitals will not count towards the requirements of 99454. So to count 16 days of compliance for 99454, the patient must have registered and recorded at least 16 transmissions captured from a connected health device that transmits that electronically and not entered manually. And the final clarification, which was originally part of the proposed rule for 2021, CMS in their proposed rule had indicated that only interactive communication would count towards the 20 minutes of time required for 99457 and 99458. They defined interactive communication as synchronous audio, meaning a phone call or potentially a video visit that had audio capability, which left a vacuum in terms of the operational responsibilities on how to cover time spent reviewing the clinical dashboard, administering the program in the dashboard. Fortunately, CMS did respond favorably to public commentary here, and in the final ruling, they did indicate that the time spent administering the care management platform can also count towards your 20-minute requirement. So very happy where that landed. If you have any other questions or details that you'd like to cover, we can certainly cover that offline. All right, so I want to take just a minute and cover how this works in a typical program and what this might look like. What you're looking at on this slide is actually a couple screenshots from a tool that we use with new clients during the onboarding process, and we can estimate the reimbursement for a practice based on parameters that are appropriate for your practice. So everything that you see on the left in yellow is actually input to the model. So total patients participating on the program, and then the exact reimbursement schedule for your specific locale, the physician's locale, would be filled in and updated based on the physician fee schedule. We also include an estimate here of what percentage of claims will be 99458 in addition to the CPT 99457. So again, that's the extra 20-minute increment reimbursement. And then the last item on the input are the technology fees. So I've estimated for a typical program based on our classic hub and connected health devices that also includes the data charges for the cellular access, the clinical dashboard access, and logistics as well, shipping the equipment, the technical support. So we'll talk about some more of those details, but this will vary by program. But that's a rough estimate at around $45 per patient per month, roughly. And then on the right, what you see are outputs to that model. So everything in green are outputs of the model. So in this case, you can see the average reimbursement per patient on a monthly basis based on these inputs is about $135.90 per patient per month. And that means on an annual basis, in this example, for 400 patients, the gross reimbursement to the practice on an annual basis would be a little north of $650,000, less the technology fees, yields about $436,000 and some change to the practice for a net profit. So just from an ROI basis, what that means is roughly for every dollar invested in the technology, roughly $3 in reimbursement back to the practice. So again, this will vary by a number of factors. I do want to take a moment though and emphasize the technology fees. I rattled off a couple items that are included in that, but I think it's what I've seen in terms of clients that we've worked with that have attempted to start an RPM program with another vendor or potentially some costs that may be overlooked in a remote patient monitoring program is something worth highlighting. So some of the hidden fees of remote patient monitoring are some of these things that I mentioned: the cellular access and the data components, the clinical dashboard access, the logistics fees, which include pairing the equipment, making sure it's paired, mapping that device hardware identifier to the patient record in the clinical dashboard, shipping that equipment to the patient's home, and then supporting them over the phone to make sure that they can get that up and running and they can use it. And even though the equipment is very easy to use and very easy to install, it's important to get that welcome call, make sure they get their first reading, make sure that the data is getting into the dashboard. And all too often, I've seen providers neglect some of these things, or worse, try to administer some of these technology and support components inside their practice. And I would caution against that. I think that one thing that we do really, really well at ClearArch Health is support these aspects of the program so that our clients and the providers that we work with can stay focused and keep their clinicians focused on what they do best, providing high quality healthcare for patients to help improve outcomes. And we provide all of that logistics support and some of the technology support to make sure that the program is transparent and seamless and easy to adopt for the clinicians and the patients.
Thank you, Chris. Before we move on to this next topic, where we're going to sum up some of the, the pearls that we've learned along the way, I thought I might circle back to both Chris and Tiffany. Tiffany had brought up some information around patient education. And I did want to make sure and mention that on our tablet technology, we do have a number of different features that during the process of planning the program, we would discuss the different features that are available. So Tiffany, I didn't know if you wanted to maybe speak to the education that's accessible on the tablet, as it's not just on the clinician's shoulders alone. So patients do have access to education on the tablet. Do you want to talk about that a bit?
Yes, absolutely. I think patient education is a vital piece to a successful program. And I think one of the things that we do really well at ClearArch Health is partner with our clients to help provide some of that education. So as we were discussing some of the phases of your program and we were talking about the discovery and implementation, one of the pieces that I mentioned was patient templates. So we are helping you identify the patients that would be best selected for this program. And in doing so, we do have education that has already been connected and designated for that patient to help. So there's a lot of education materials that the patients would receive through the tablet. And that is to kind of substantiate the treatment they're getting, right? Because they are partnering with their clinician. The provider is offering that guidance as well. But it's nice to know that as your partner, we're also keeping them with getting relevant education that's really going to help substantiate the treatment plan and just make sure that we're addressing all aspects of the patient education.
Thank you. That's helpful. And Chris, you had brought up some of the materials that we include in the boxes that are delivered to patients directly. And I just wondered if Dr. Subramanian, you could speak a little bit to how helpful that might have been for your patients on program when they received their kits, and describe the kind of plug and play experience and whether or not that information has been helpful to your patients.
Well, yeah, I mean, I think it's been absolutely important, of absolute importance in engagement from the get-go. I mean, we learn as children that we want to take our Christmas presents out of the box and start playing with them immediately. And I don't think those expectations really change as you get older and infirm. And the opposite of that is true. I've thrown away many IKEA products because I just didn't have the patience to put them together. And so when you're dealing with healthcare and out of the box experience, where you just pull it out and turn it on and it talks to you and sets it up, and there's somebody that calls you and kind of walks you through it. It's, you know, a personal touch and a convenience of use variable that you really cannot overlook.
Thank you. So now I'll summarize the setting the stage for a successful program. What we consider important and what we've come across in our years of learning is that when you share your program plan or your program vision with your technology partner, that really begins, it sets the stage for the collaboration. Then we can work together, much like we did with CarePortMD, to develop a program that fits their needs, their care model. And at the same time, we can develop other areas that may be helpful for future growth or change development. We also suggest that you select technology that the patients will adopt. And the nice thing about Mobile Help and ClearArch Health is that we have foundations built in creating really good technology that end users like to use, even in their most vulnerable points. So we want to make sure that patients on a daily basis interact with these devices, and they want to interact with these devices. That's very important. So you do want to be careful about the technology you pick. It also leads to the fluidity of your data. When you have good, solid technology standardized across your population, you can rely on that data flow. And then you also have a partner who can help you make sure that data continues to flow if there's any hiccups. Creating a program plan to enhance your current model of care, it's really about where do you build remote patient monitoring into your digital health strategy. And we work with you to help you identify the requirements to change in your workflows and how to communicate with your patients about how to participate in our RPM program. It's very important, as Tiffany mentioned, setting the stage. Creating a clear patient enrollment and education plan. Tiffany covered off on this really, really well. And this is really critical. The communication between people is important. Sometimes the technology will uncover opportunities for that communication, but people are very important. So create those pathways, whether it's escalation of alerts, managing compliance, or if it's actually a discussion with the patient and reinforcing their good behavior too. Determining your staffing plan, in-house and outsourced staff. There are many organizations that tackle monitoring their remote patient monitoring programs in-house. You just want to identify champions within your program. You want to make sure that you're cultivating people to work up through the chain to become the champion of the program. And you want to make sure that you are able to meet the needs of that patient population you select to launch. Developing a workflow plan to streamline communications. Again, communications, escalations, understanding what standardizations you want to put in place, and the documentation process to follow that. So these are all key takeaways. So I want to thank you today for joining us at this webinar. We're going to go ahead and turn to the Q&A. And I think we have a fair amount of questions in the inbox. And I think I'll turn the first one over to Chris Otto. Chris, could you talk about integration into the platform?
Yeah, I'm happy to. Almost every client that we work with, that's a common question and a common request that the data does be populated into the patient electronic medical record. So this is commonplace, and We have an integration platform that we work with that works with most common EHRs. So in most cases, we can leverage that to provide that integration at the start of program. Those integrations kind of vary on the interface depending on the EHR platform or the EMR platform, but typically they include a feed from the EHR back to our platform for ordering purposes and enrolling patients in program. And then they also include an interface in the other direction for pushing the results back into the EHR. Almost always, in most cases, if depending on the program, the clinical dashboard, our clinical dashboard, will always have more detail and more charting available of the RPM equipment and the data collected through that dashboard. But all the results and the most pertinent data can be populated into the EHR as well. So hopefully that answers that question.
Thank you. That does. What logistical services does ClearArch Health provide? And also the technical support side, what services are provided?
Well, I'll take that one again too, Doreen, if you don't mind. I saw Russ Dahman just ask that question. I was about to answer that on the Q&A. But the logistics, as I mentioned, is something that I think we do really, really well at ClearArch Health. And our goal is always to try to support clients and provide that heavy lifting so that they don't have to. But to be specific, those services include the pairing of the equipment, so pairing the Bluetooth equipment with the hub. So whether it's, if you have two devices, so for example, for a typical CHF program, we might include a connected blood pressure monitor and a connected weight scale and a hub that would go to the patient. We will pair those devices in advance, ship that directly to the patient home. We will ensure that the equipment is set up and operational. And if it's not set up by the patient, then we can monitor that and make phone calls and help the patient get the equipment set up and operational. We also manage any support aspects that come up. So if for some reason the patient has a technical question, then we will manage that so that those questions are not directed to the provider. And then if the patient does disenroll from the program, so specifically in the acute, in the acute care case that's now allowed for 2021, the patient may disenroll from the program, and we will coordinate the return shipping of that equipment as well. So we'll get the equipment back. We'll sanitize it so that it gets ready for the next patient and gets ready for the next deployment. And as I mentioned, those are some pretty daunting tasks. I've seen healthcare organizations, provider groups manage that for small patient populations on their own, but beyond 25 or 50 patients, I've seen cases where the kits are going out and the wrong equipment is paired to the wrong kit, or it's mapped to the wrong patient's record. So these are some things that we can avoid on a headache basis and manage that for our clients.
Great, thank you. And then there's a question around the reliability of devices and technical support. And I think that there's a couple different ways to answer this. So Chris, you may want to answer in part, and Tiffany, you might want to answer too, because sometimes technical issues are actually maybe a device use issue. So can you kind of speak to technical support in the context of both patient utilization of devices and then about the reliability of devices, Chris? So we'll have Tiffany go first.
Thanks, Doreen. I think, yes, this is a balance, and I think we do a good job here at ClearArch Health with this. As Chris was mentioning, handling the logistics of the device is one aspect, but also making sure that we provide education and some clinical guidance to our clients to make sure that that clinical welcome call is robust enough to really go over how to use the devices properly and best practices, because there is a synergy there. So we do have the technical support there that's ready to answer any technical questions, but I think we do a really good job of socializing how to use the devices and the importance of educating your patients on how to use them so that they understand how to use their device and kind of navigate some of those issues. So there is a close relationship between the patient education as well as the actual appropriate use of the device.
Great, thank you, Tiffany. Now, Chris, if you don't mind, maybe speak to the devices and how we select devices, quality of devices, and then support on the technical support side.
Yeah, sure. I'm happy to. Um, of course, we manufacture the hub, the RPM hub, and then we partner with uh, best-in-class organizations that provide the connected health devices. So we don't directly manufacture the blood pressure monitors or the pulse oximeters, et cetera. We partner with well-known organizations like Nonin and A&D Medical, Indy Health, and um, um, True Metrics that makes the glucometer. So we partner with those organizations. These devices and these companies are FDA registered device manufacturers. So they're held to very stringent standards on the quality side. And of course, we do a lot of our own testing to ensure that those can be used with our program and they're easy to use. Um, did I answer the whole question there?
I think
The
you
tech
did.
support?
Yeah.
I think that maybe the question also had to do with reliability, maybe. So, I think, I can speak anecdotally to the reliability. I'm always touched by some of the comments from industry veterans. So if we work with providers or organizations that have used RPM for over a decade, then the feedback they give me is they're used to going to demos and patient deployments where the equipment never works on the first try. So we always get high praise in that regard. I know that's a bit anecdotal, but we can certainly share details of the equipment and the support rates and support call rates. But it's very reliable and very easy to use. Did I cover everything?
I think you did.
Right.
There was another question that came through with some of the registrants, and so I'm sorry, I'm going to forget some of the names, but there was a question around quality and outcomes, and Chris, you may want to respond to this, but we do approach. I'll kind of lead you along the way on this response, because we do partner with organizations to track data and analytics, but we also have a fair amount of data and analytics that we provide on our side and reporting capabilities. Can you speak to those reporting capabilities a bit so that people can understand how we track some of the outcomes that they would gather through a remote patient monitoring program?
Yeah, certainly. As our role as a technology company in managing the logistics, our logistics reports are a pretty common staple report that we provide to all programs. So providing weekly and monthly reports in terms of equipment that's shipped, where it is, if it's in transit, if it's been used by the patient, or if it's still waiting for the first use, and then of course on the return shipping, we track that as well. We also track because so many of the organizations that we work with are funding their programs by way of CMS reimbursement, and we track through our dashboard. We track the compliance towards CPT 99454 and 99457, showing time spent in each patient record as a running total for the month, so that you can see if towards the end of the month, if you've not yet met the requirements for 99457, that's available, and that allows our clients to focus their efforts to make sure they meet that compliance.
Great, thank you. Ross Daman asked, what are ClearArch's onboarding costs? And Chris, I think that one is pointed to you too.
Yeah, so we don't really charge our clients for onboarding. So we have programs that are optimized for 4 primary disease conditions: CHF, COPD, hypertension, and diabetes. And unless we're doing something customized, there's typically not an onboarding cost with a program. We do typically, however, collect a program deposit to cover our costs for the training and setting up the equipment, shipping those initial equipment. But that deposit is always applied towards the technology cost. So it's not really an onboarding cost.
Great, thank you. There is a question, and I think, Chris, this might be directed to you. John Donnelly asks, is there an actual order created or required to be set up in the EHR for the RPM program against which the RPM data and observations are received and reported? So along the same lines as integration. So if you don't mind taking that one, Chris.
Yeah, I can certainly take a stab at answering that. Although I will just point out that I'm not an attorney, so I'm not really able to advise on detailed billing practices for the billing practitioner. So please double check anything I tell you with your appropriate counsel. That said, it is important to document the patient's consent. So I'm aware that the patient has to, as I mentioned, the requirements, the patient has to consent for the program. I may not have actually mentioned that when I covered the billing, the reimbursement, but the patient has to have provided their consent to participate in the RPM program. And it has to be deemed medically necessary by the billing practitioner. And then you have to meet the other requirements that I indicated with the 16 days. So other than that, there's not an order per se that would have to be documented in the EMR. So hopefully that answers your question.
I think the question may have been about whether or not through integration, whether or not they could establish an order for a patient to join in an RPM program. So that may have been the question.
Well, it's okay. Well, I apologize. For some reason I don't have that question on my screen, so I may have may have not been able to read it correctly. But as far as integration goes, it's going to differ from the EHR. But in the case of some integrations, the way that works is the patient may be enrolled in a specific service, and that would define the trigger that would constitute the order. So it would vary by the EHR, and we'd certainly be happy to work with you to define the exact workflow for your EHR.
Thank you. 2 responses. We'll probably nail it with one of them, I'm pretty sure. So there are a couple questions around devices. So one of them was pertaining to Apple generated data. And then there's another one about from Nathaniel Sims about the future of body-worn physiological monitors, such as BioIntelliSense or BioSticker. And really what I think it is a discussion around how we source our devices or what types of device data we're pulling in, and maybe a little bit about our roadmap around devices might be the best way to approach multiple device questions. Chris, can you tackle that?
Yeah, I'll certainly try. We have a pretty broad ecosystem today where we cover multiple blood pressure monitor devices, weight scales, pulse oximeter, connected glucometers. We have 2 different connected glucometers. This year, we've added a thermometer, in part driven by COVID-based programs, and we've also added remote A1C and a peak flow and spirometer. So we're constantly expanding that device ecosystem. In most cases, it's really driven by client demand. So if we have a provider group that has some specific goals, then in most cases we will entertain the idea of integrating that specific device, and we will do that. And put that on the roadmap, provided it's, something that, we think we can use, broadly. And then if not, we can look at something doing something custom as well. The wearable devices, we do have an activity tracker that we are releasing in January, actually. So early next year, we will have a wearable activity tracker that will track steps and heart rate and sleep patterns. So that will all be included in the data stream as well. Now, for the reimbursement specifically, CMS did clarify in 2021 that the device must be an FDA registered device. So that's just something to keep in mind, that at the bare minimum, you must have at least one device in the patient kit that meets that requirement in order to meet your 16 days for 99454. So hopefully that helps.
Thank you. And, we're coming to the end of our webinar, and we're coming to the end of time, but we will be sending out a recording. We will also respond to the questions on tap. There was a question specifically around data filtering, alarm algorithms, and just so you know, we do have clinical dashboards that prioritize patient populations so that you have data to react to. That's part of the platform. So I want to thank everybody for joining, and thank you, Chris, thank you, Tiffany, and a special thanks to Dr. Ashok Subramanian for joining us today and sharing your insight about launching an RPM program, about your experience with your clinical team and your patient population. Is there anything else anyone would like to add before we say goodbye? Chris, do you have any final thoughts?
No, just thank you everyone for your attention today. It looks like we had a pretty large crowd today, so I apologize if we didn't get to your question, but we will certainly follow up after the webinar. Thank you so much.
Thank you. Tiffany, do you have any last minute thoughts?
No, but just thank everyone for attending. We appreciate it.
Dr. Subramanian, do you have any last minute thoughts or shares that you'd like to share with the audience?
Other than the fact that I really enjoy what this is doing for our physicians and our patients alike, it's really the next wave of healthcare. And one thing that you want to keep in mind, they talked about the functionality of this device as being able to deliver education, but one other really important actionable result of this tablet is that you can actually deliver telehealth through it as well, which is one of the things that we do. So all of our patients on the RPM program now have a portal directly into their home where we can have a telemedicine encounter and also have the advantage of vital signs to give us context to increase the value of that telemedicine encounter by orders of magnitude. So think about how you can integrate your RPM program with your telemedicine program, and now you have a level of actionability with that RPM data that you wouldn't have had previously.
Thank you. That's very important to mention. So thank you for doing that. Again, thank you everybody for joining in with us today. We really appreciate the time you invested in spending with CarePortMD and with ClearArch Health. Thanks again. We'll send you the recording soon. Take care.